Hello, my name is Lydia Young, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of the University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today, we are summarizing Understanding Transitional Care Programs for Older Adults Who Experience Delayed Discharge, a scoping review, by Catherine S. McJilton et al. The keywords for this article are transitional care programs, delayed discharge, and older adults. The research questions for this article are: what older patients find themselves in transitional care programs? What are the core services delivered in transitional care programs? What patient, caregiver, and health system outcomes as a result of the program have been studied? Why is this important? Transitional care programs were created to help hospitalized older adults, including helping them go back home. Little is known about the factors, i.e., patient, staff, and environmental aspects, that may influence the use and outcomes of transitional care programs. Background: many older adults live with multiple complex health problems. They may experience unexpected situations, for example, falls, that result in acute care hospital admissions. But some patients who no longer need acute care cannot be discharged right away. These patients are transferred to transitional care programs. Transitional care programs are designed to provide short-term and low-intensity restorative care. Methods. This study used the scoping review method to describe core components of transitional care programs and describe outcomes used to evaluate transitional care programs. Definitions. Scoping review: an initial assessment of the potential size and scope of available research literature. The aim of the study was to identify the nature and extent of research evidence. What older patients find themselves in transitional care programs? The average age of participants studied ranged from 72 to 86 years. Most were older women with multiple chronic conditions. Some had cognitive impairment, needed help with daily activities, and lived alone. Transitional care staff included physiotherapists, nurses, physicians, occupational therapists, and social workers. Transitional care programs were housed in long-term care homes in 12 studies, skilled nursing facilities in 5 studies, community and rural hospitals in 5 studies, purpose-built intermediate and transitional care facilities in 4 studies. What are the core services of transitional care programs? The 5 core components included in most transitional care programs were: number 1, assessment. For example, primary clinical diagnosis. Number 2, care planning and monitoring. For example, care plans. Number 3, treatment. For example, rehabilitation. Number 4, discharge planning. For example, making referrals. Number 5, patient, family, and staff education. For example, coaching. What patient, caregiver, and health system outcomes have been studied? The main outcomes examined were functional status and discharge destination. Functional status. 18 studies looked at functional status measures such as the ability to perform activities of daily living, bathing, dressing, walking, etc. The majority of studies reported improvements in functional status of patients admitted to transitional care programs. Other patient-related outcomes included psychological status, health status, and quality of life. Conclusion. Transitional care programs can influence outcomes for hospitalized older adults. This includes helping them go back home. This highlights the need to design transitional care programs to be delivered by interdisciplinary teams. This may help to accommodate persons with cognitive impairment and involve care partners. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.